For Rebel News, I'm Tamara Ugolini, and many of my fellow Ontarians are now very familiar with unelected public health bureaucrat Dr. Kieran Moore. His College of Physicians and Surgeons of Ontario file notes that he is trained in community, family, and emergency medicine. He served as the Medical Officer of Health for Kingston, Frontenac, Lennox, and Addington from 2011 to 2021. Dr. Moore is also the Medical Officer of Health of the Department of Emergency and Family Medicine, as well as the Program Director of Public Health and Preventative Medicine at Queen's University in Kingston. On June 26, 2021, he was appointed as the Ontario Chief Medical Officer of Health. But does his prior involvement with Pfizer-sponsored vaccine research influence the vaccine mandates he's since provided directive on? Let's dig in.
Also critical in our fight against Omicron is vaccination. Ensuring that all eligible Ontarians are able to receive their vaccinations as quickly as possible is of the utmost importance to reduce the risks of morbidity and mortality from COVID-19 and maintain critical operations in our healthcare system.
Since his appointment, Dr. Moore has continued to push modeling predictions, which, according to the hierarchy of evidence, rate as the lowest quality of evidence with high risk of bias. And it makes one wonder why. That chart there shows systemic reviews as the highest quality of evidence with the lowest risk of bias. And after nearly 2 years of navigating these unprecedented times, undoubtedly, there is enough data available to analyze and conduct such a review as it pertains to modeling accuracy, how well mandates and government restrictions have worked, etc. Why aren't experts like Kieran Moore, as he's proclaimed to be, doing such investigative work? Well, perhaps a conflict of interest is at play, and it seems that Kieran Moore himself discloses it. As far back as 2018, Dr. Kieran Moore has been leading a national initiative, a multidisciplinary research network, the $4 million Pan-Canadian Research Network on Lyme disease. But how does this tie into the now in 2021 when we hear segregationist language bordering on hate speech from Dr. Kieran Moore, like this compilation by data and analyst Kelly Brown?
Although cases are on the rise, the fourth wave is primarily being fueled by the unvaccinated amongst us.
If it's a mixed group of vaccinated and unvaccinated individuals outdoors, you may consider keeping masks on. And certainly if you go indoors, I would suggest you keep your masks on in a combination of groups of vaccinated and unvaccinated. I do believe it's a very small proportion of individuals that would commit this fraud. And if we continue to hear or see transmission in these settings, it has to be because unvaccinated or are mixing with vaccinated individuals. We will treat this very seriously going forward, especially if our rates go up and or we see transmission in those areas where they should have had verification process. We don't want vaccinated and unvaccinated populations mixing and transmitting the virus as we go indoors. I am concerned as we go indoors. We know this virus likes low humidity, that it can stay in the air longer in those environments, that there is a risk of transmission, and hence the reason we need only vaccinated, protected people going into those venues to keep them safe. So in terms of the proof of vaccination, we'll continue to monitor the data and make recommendations to government. A basic means of protecting individuals is stopping the mixing of unvaccinated and vaccinated.
A mere few weeks before Kieran Moore's appointment as the Chief Medical Officer of Health, the Kingstonist posted this article that shows in point number 6 that there is no vaccine yet for Lyme disease, but Dr. Moore is quoted as saying that Kingston, Frontenac, Lennox, and Addington may be the site for an international vaccine trial in the coming year. Okay, so Lyme disease vaccines and COVID injectables. There's no connection, right? Well, I think that's wrong. In a Pfizer press release dated July 19th, 2021, VLA-15 is the only active Lyme disease vaccine candidate in clinical development. VLA15 is the Lyme disease vaccine candidate being produced by Valneva, a specialty vaccine company in partnership with, you guessed it, Pfizer. To make matters more concerning, on March 12th, 2021, Dr. Kieran Moore was a panelist for a slideshow presentation called Changing the Way We Work, which was focused on COVID-19 vaccine questions and the rollout for family physicians. In that presentation, and further noted on slide number 8, Dr. Kieran Moore declares and that he is on the advisory board of Pfizer for their Lyme disease North American strategy.
I do receive grants from the CIHR for Canadian Lyme Disease Research Network, for which I'm the principal investigator. Have an honoraria from the Ontario College, and I'm on the advisory board of Pfizer for their Lyme Disease North American strategy.
And he was a member of the Ontario Vaccine Advisory Committee, which I find odd because I can't actually find a vaccine advisory committee. But I did dig up the COVID-19 vaccine task force, which the Star reported was disbanded at the end of August as, quote, the province struggles to increase vaccination levels. So, at the request of Kieran Moore, the above task force was replaced by the Ontario Immunization Advisory Committee. This was all right around the time that Ontario made COVID-19 vaccination policies mandatory in certain workplace settings, which has since ricocheted almost to everyone. So the COVID-19 vaccine task force is disbanded because Ontarians stopped taking the vaccines, and enrolls Kieran Moore with a new committee that then mandates them. That doesn't seem coercive at all. Okay, back to Kieran Moore. I reached out to him to seek some clarification before I ran this story. What I wanted to know specifically was what his title was on the Pfizer Lyme Disease Advisory Board. What is the total monetary value of employment, research grants, and or consultation funding and fees charged that he has received from Pfizer since March 2020? Does his employment, research grants, and consultation funding and fees, etc., affect his ability to provide unbiased and balanced reports to the Ontario government and subsequently to government-funded media outlets? If not, why not? Has he or any company or consulting firm that he is associated with benefited financially or professionally since lockdowns began in March 2020? If so, how and to what extent, monetarily or otherwise? I mean, he did receive a nearly 30% raise in 2020, bringing his 2019 salary of $325,724 salary up to an astronomical $412,637 during a year when an unprecedented amount of Ontarians, those already making the least, experienced record job loss that furthers the divide between the rich and the poor. Kieran Moore got richer. As it goes with unelected, unaccountable bureaucrats who appear to have capitalized on pandemic response, Dr. Kieran Moore didn't respond to my request. And so I filed an access to information request to get my answers. Stay tuned. For Rebel News, I'm Tamara Ugolini. It's only with your help that I'm able to conduct this kind of research. Access to information requests can be time-consuming and costly. To keep supporting me in my efforts, please consider donating whatever you're able to at rebelinvestigates.com. Your donation will help to ensure that I can keep digging deeper into these kinds of topics as they arise. That website again is rebelinvestigates.com.